Welcome to the Coffee with Compliance call. My name is Colleen Patterson, and I'm the Vice President of Employer Services and Compliance at Savoy. Joining me today is Sara Simkins, who is the Senior Compliance Specialist here at Savoy. Sara and I are super pleased to bring to our audience a recap of all the happenings in the legislative and regulatory landscape that's been happening over the course of the last month. And it certainly has been impacting employee benefits. What we're going to be doing with these calls is we're going to release them on the first Tuesday of each month, and it's going to recap the prior month's news. In addition to that, we're going to share any helpful tips that there are, cover any frequently asked questions when it's relevant to the topic, and give you information on where you can go to our website to find more details. So with that, Sara, let's get started.
Well, to start, the affordability percentage for 2023 has been announced, and it's a decrease. So now affordability is 9.12%, which is down from 9.61% in 2022. So this means employers have to pay a greater percentage share of their premiums. So employers who calculate affordability right on the line may need to recalculate at their next renewal. And while we're on the topic, as a reminder for some upcoming deadlines, the 1095 forms need to be delivered to employees by March 2nd of 2023. Paper filings are due to the IRS by February 28th of 2023, and electronic filings are due by March 30th of 2023. And another reminder, employers that file 250 or more information returns with the IRS have to file electronically. In addition to that, tentative penalty amounts for 2023 have been announced. So penalty A is now $2,880, which is up from $2,750 last year, and penalty B is $4,320, which is up from $4,120 last year. And as a reminder, penalty A is the penalty for not offering coverage, and penalty B is the penalty for not offering affordable minimum value coverage. Next, on July 28th of 2022, the Departments of Labor, Health and Human Services, and Treasury issued new FAQs clarifying their interpretation of the ACA's requirement that non-grandfathered health plans provide contraception to participants at no cost. So these new FAQs were issued in response to President Biden's executive order on reproductive health. Covered plans are required to automatically cover at least one form of contraception in each of the categories listed in the FAQs without applying medical management. So CRQF published for a chart on the various categories and any further information on these restrictions.
So next, on August 3rd, the Biden administration issued a second executive order addressing actions the administration is taking to promote access to reproductive health care in response to the Supreme Court's recent Dobbs ruling on abortion. There's a bunch of stuff that was covered there, but one of the items that was covered in this second executive order is that they were announcing a policy of supporting women's ability to access reproductive health care by traveling to seek abortion care in states where it is legal. This follows an initiative executive order that Sara was just mentioning, which happened last month in July, and it was July 8th was the executive order, and as she had shared, there was more information that came out on July 28th. So that first order, as Sara had mentioned, the Departments of Health and Human Services, they were taking steps to address those effects. But what happened with this next order is that these steps were clarifying the obligation of hospitals and providers under the Emergency Medical Treatment and Labor Act. And that act specifically states that patients that are presenting at an emergency department with an emergency medical condition can and should receive stabilizing care. And that includes any kind of emergency treatment as a result of an abortion, especially if that care is necessary to stabilize the emergency medical condition. Also, the department's guidance addressed the nation's retail pharmacies on their obligations under federal civil rights laws to ensure equal access to comprehensive reproductive and other healthcare services. And that's including for women who are experiencing miscarriages. If you check out our news section on our website, you can find more detailed information about the two executive orders. So moving along, on August 4th, again, the Department of Health and Human Services, they published its proposed rule for non-discrimination in healthcare and activities. And again, it's a proposed rule, which means it hasn't been decided on yet. However, it's important to note because If this goes through, these regulations pertain to Section 1557 of the Affordable Care Act. Now, as a reminder, Section 1557 of the Affordable Care Act prohibits discrimination on the basis of race, color, national origin, sex, age, and disability in certain health programs and activities. Now, the proposed rule changes, they are extensive. So if finalized as they're proposed, the rule is going to greatly expand the protections for applicable individuals. It's certainly going to extend the applicability of Section 1557, and it, of course, is going to increase the compliance obligations for covered entities. The next topic that I have is that, believe it or not, there has been some news in the Blue Cross Blue Shield antitrust settlement. On August 9th, a federal court approved the proposed $2.6 billion settlement. Now, in this approval order, what it means is that employers who submitted valid claims are one significant step closer to receiving their settlement proceeds. However, payments from the settlement fund will only be made after any appeals, assuming appeals are being filed, are actually resolved. So any interested employer should check the Blue Cross Blue Shield settlement website for updates. Next topic that I have is on August 11th, the Centers for Disease Control and Prevention, that is the CDC, they released new guidance on the control and prevention of the COVID-19 virus. The CDC's latest focus is on individual responsibility, the removal of distinctions between vaccinated and unvaccinated individuals, as well as the removal of quarantine recommendations. And there has been a discussion as far as mask wearing and that being an individual responsibility. All of this combined is really meant to help employers who are considering relaxing their COVID-19 workplace requirements. It's to give them further guidance in order to do so. So in response to the recent CDC guidance, employers really should look to update their pandemic employee exposure control plans and take into account these changes, as well as make any updates to any of their vaccination policies that refer to CDC guidelines.
And all of this recent legislative action has been building up to the Inflation Reduction Act, or IRA, which was signed into law on August 16th. So this means that now, for the first time, HHS can negotiate prices for some of the most expensive drugs covered under Medicare Part B and Medicare Part D. So this program is to be phased in through 4 stages over several years. Phase 1 will be negotiating 10 Medicare Part D drugs, and this will take place in 2026. Phase 2 is to negotiate 15 Medicare Part D drugs, and this will take place in 2027. Phase 3 is to negotiate 15 Medicare Part B or D drugs to take place in 2028. And Phase 4 is to negotiate 20 Part B or D drugs, and this takes place in 2029. The Secretary can then negotiate 20 drugs in all subsequent years. There's no official publicly available list of drugs that HHS plans to target for negotiations, so that remains to be seen. The IRA also eliminates the 5% coinsurance for catastrophic coverage in Medicare Part D in 2024 and will also cap Medicare Part D patients' out-of-pocket costs at $2,000 per year in 2025, with the option to break the amount into affordable monthly payments. It also institutes a new provision to impose penalties on drug companies who hike up prices in Medicare above the rate of inflation. In addition to capping annual out-of-pocket costs, the IRA creates a $35 a month cap for insulin products under Part D and expands cost-sharing assistance for low-income people with Medicare. And finally, in addition to all of that, the IRA extends the enhanced ACA subsidies that were first offered under ARPA until 2025. It also extends the American Rescue Plan provision that allows many low-income families receiving a subsidy to continue to receive that subsidy.
So that is our wrap up for this month. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use all of the resources available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.